Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about why you should not be scared of a medical diagnosis. There are some people who like to say that the fear of knowing a medical diagnosis can kill you faster than the disease itself. So such people will not want to come and do a medical checkup because they are afraid of what we might find. There are some also who, even though they are ill, they don't want to come to the health facility because they think that we might give them a diagnosis that they cannot handle mentally or emotionally. Okay, so in this video, I want to talk about why you should not be scared of having a medical diagnosis. The first reason is that every medical diagnosis goes with a management plan. So we don't make diagnosis in isolation, all right? The reason we have to make a diagnosis because there's a management plan that goes with every diagnosis, all right? So then it becomes a necessity to make a diagnosis. Now, that management plan might not be a cure, all right? But it will always be a plan that can improve outcomes, can prolong your life, can prevent complications or delay complications, can delay disabilities or prevent them, can prevent you from becoming an emergency, going in and out of hospital frequently. It can improve your quality of life. So all the time there is a diagnosis awaiting some symptoms, and there are some management plans awaiting those diagnoses. So please, diagnosis is not in isolation. It comes with a plan to deal with the situation. All right. So if you get to have a diagnosis, there's a management plan that is awaiting you. Okay. The second reason why you should not be scared of um, getting a medical diagnosis is that health professionals are trained to be able to break bad news to people in a manner they can handle emotionally and mentally. So we don't break bad news as a surprise. Okay, we don't surprise you with bad news like a snake bite or like an ambush. We try to make sure that we create an atmosphere both externally and in an internal atmosphere in you that can help you handle the um, medical diagnosis without it becoming a source of chronic worry, anxiety, and fears. All right. So there's always some counseling support. There's always some form of support that is available to make sure that we can give you, can break news to you in a manner that you can handle. All right. And for your information, many health professionals shy away from getting you to know your diagnosis. It means that we are always concerned about how you can handle that medical diagnosis. If we had our own way, we don't want you to know your diagnosis, but it is wrong for you not to know your diagnosis because it is your diagnosis. So you have to know. It is also important for you to know because I'm going to be discussing a management plan with you. And what are we managing? You should ask. All right. So you must know your diagnosis. And for some people also, even though on one side, medical professionals are hesitant in making you know your diagnosis because of the negative thoughts that will go through your mind about those diagnoses. There are some people who have had scary versions of certain diseases. So when they hear hepatitis B, they think it's very scary. Meanwhile, the doctor does not think so. They hear of typhoid infection, they think it's like an infection that can be treated, but there's another version out there that some drug sellers in the media are propagating. All right, so then we are thinking that if I tell you you have urinary tract infection, you'll be thinking it means it's sexually transmitted infection. Sexually transmitted infection. So then you are going to be fighting with your partner for bringing you an infection. So I have to now explain again that please, this urinary tract infection is not sexually transmitted infection. So don't go and fight your partner. To avoid too many talking, I would just think that look, What you want is to be well and not to know your diagnosis. So that is why some people complain that, oh, the doctor did not even tell me what is wrong with me. The fact is that we don't delight in scaring you with diagnosis. If we had our own way, we are thinking that you just want to be well, right? And once we are giving you treatment and you are okay, we are okay. But it is wrong for you not to know your diagnosis because it is your diagnosis. Number two, once we are giving you treatment or managing you, you should know what we're managing you for. Number three, there are some people also who might be thinking the worst. So once we tell them that, look, this cough that you've had for 2 weeks is not tuberculosis, it is some upper respiratory tract infection, then you alleviate their fears. So for some people, we have to let them know their diagnosis so that you tell them that, look, this swelling is not a cancer that is developing. It's a swelling that can be removed and it's not going to cause any problems. Okay, so it is only out of necessity that we get to make you know your diagnosis. And when we do that, we know the conditions that can arouse some fears in you. By now, we know those conditions that we call them acute conditions that can be eliminated within some days or weeks. So if you are telling you have some infection, like a pneumonia, like urinary tract infection, you are not going to think that you are going to be thinking it's a death sentence. So we tell you to give you medication. But if it has to do with some chronic infection or disease, that is when you are thinking that, can you handle this news? That is where we put in the efforts, okay, to help you handle the situation in a manner that alleviates your fears and worries and concerns. All right. The third reason why you should not be scared of a medical diagnosis because early diagnosis of diseases lead to early treatment or management that could lead to improved outcomes. And in this case, ignorance is not always bliss. As people say, ignorance can kill you. The fact that you don't know you have your blood pressure is up, right? Because blood pressure, we believe, does not cause symptoms usually, unless it is very high or that's led to some complications. You're having symptoms from those complications. So if your blood pressure is high, but we have not measured to know, and it is working silently to give you some cardiovascular disease in the future, you cannot say that not knowing you have blood pressure has benefited you in any way. In the same sense, if your blood cholesterol is high, you're not going to feel symptoms in your body. But they are narrowing your vessels and then may impair blood flow in the future that can lead to some stroke or heart attack, for instance. So not knowing your medical issues, I mean, does not come with any benefits. All right. It's good to know and then get them managed. Okay. So why you should not think that the idea of a medical diagnosis is to scare you is because, number one, we make diagnosis out of necessity because we have to pull out a management plan that is tailored to that specific diagnosis. Had it not been so, we are not going to make any diagnosis. Number two, the idea of thinking that doctors make diagnosis to scare you is not true because we are rather trained to break bad news to you in a manner that you can handle, all right, mentally and emotionally. Okay, so if we had our own way, we are not going to tell you your diagnosis, and that is wrong because you need to know. Okay, but we know how to break bad news to you so that you can handle them emotionally and mentally well. Then number three, early diagnosis is important for a lot of diseases, so we can start managing early. Okay, so that is why it's important that you are not scared of having a diagnosis, whether through medical checkup or by coming to the hospital early when you have a certain medical illness. Okay, so thank you very much for watching this video and subscribe to my channel. Thank you.